How to manage open fractures in trauma. When it comes to managing open fractures and trauma, the stakes are high. These injuries, where the broken bone breaks through the skin, requiring immediate and careful attention. Let's break down how to handle these situations effectively, especially in high-risk professions like logging, deep-sea fishing, and storm chasing, where such injuries can happen in remote areas. First things first, the priority is to stabilize the patient. You must assess their airway, breathing, and circulation. This is essential before addressing the fracture itself. If there is bleeding, apply direct pressure to the wound. If the bleeding is severe and does not stop, a tourniquet may be necessary, but this should only be used as a last resort. Next, it is important to cover the wound with a moist sterile dressing. This helps protect the injury from dirt and bacteria, reducing the risk of infection. Once the wound is covered, it is time to think about antibiotics. Administering intravenous antibiotics within 1 hour of the injury is ideal. The choice of antibiotic will depend on how large the wound is and how contaminated it may be. Surgical intervention is a critical step in managing open fractures. Urgent surgical irrigation and debridement are necessary to clean the wound thoroughly and remove any dead or contaminated tissue. The timing of this surgery is important. The sooner it is done, the better the outcomes tend to be. During surgery, skeletal stabilization is performed to align and secure the broken bone. This can involve external fixation devices or internal hardware, depending on the specifics of the injury. Soft tissue management is another key aspect. If the wound requires it, soft tissue coverage, such as skin grafts or flaps, should ideally be completed within 7 days. This helps protect the bone and promotes healing. The extent of soft tissue damage will influence how severe the fracture is and will guide the treatment plan. Open fractures are classified based on the size of the wound, the level of contamination, and the amount of tissue damage. The Gustilo-Anderson system is often used for this classification. This helps predict the risk of infection and informs the treatment approach. Orthopedic surgeons should be involved early to assess the fracture and plan the best course of action. For those in high-risk jobs, immediate medical help may not always be available. Basic first aid is essential, focusing on controlling bleeding, protecting the wound, and ensuring rapid evacuation to a medical facility. Having portable sterile dressings and antibiotic kits can be life-saving in remote locations. Understanding the urgency of early antibiotic administration and surgical intervention can make a significant difference in survival and limb preservation. Managing open fractures in trauma is all about quick action, effective wound care, and timely surgical procedures. Being prepared and knowing what to do can save lives and improve outcomes in these challenging situations.